2019 has been an amazing year for health in the East Berbice Quarantine region, with many projects completed and commissioned. During the month of April 2019, several new projects were commissioned while others were retrofitted, refurbished and recommissioned. On this InfoHub Extended, we examine these projects and their benefits to Guyanese.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest would provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.
Firstly, 2 health centers were commissioned at Pletanka on the east bank of Berbice and number 76 village on the Quarantine coast. Here are 2 residents of East Bank Berbice who were grateful for having such a facility in the area.
Shortly, I get a health center here, I come to visit the doctors, and no complaint. The doctor was very, very thankful. I have good treatment, also the nurse. Nearly a month, every day, I come for a dressing. I never expect one thing like this to happen because to travel from Wegland to New Amsterdam is not easy. You gotta wake up 11 o'clock in the morning to get New Amsterdam. And now I wake up all the morning, make my tea, look after my cattle, and come to the health center.
With this health center here, this will reduce the amount of persons traveling the road from as far as Cape Mood and Mara till to Brothers to New Amsterdam to receive medical attention. And I'm sure that the government has looked into the situation, see that we are in need of a health center, and today this is the result. We have a health center, it's functional, we have very friendly staff.
The Director of Health Services in the region, Javon Stephen, noted that the $14 million health center is located just about 18 miles from the town of New Amsterdam. This was taken into consideration before its construction.
And at Regional Health Service, we decided that if we want to make Health Vision 2020 a reality, Pletanka is a good way to start. One such component of Health Vision 2020 is to ensure universal healthcare coverage.
Meanwhile, the $15 million health center at the number 76 village comes as a convenience to more than 4,000 residents of surrounding villages. They will no longer have to worry about traveling long distances for primary health care services. Former minister within the Ministry of Public Health, now Foreign Affairs Minister Dr. Karen Cummins, noted that it is necessary for government to provide quality health care which is equitable, accessible, and patient-centered.
His Excellency David Arthur Granger has changed the name of the Ministry of Health to the Ministry of Public Health with a focus on the public, you the public. And so the mandate in public health is to ensure that we have healthy people and healthy communities. And hence it is to ensure that we provide the best quality public health care to all the people living in Guyana and including you.
Up at the district hospital at Skeldon, which is closest to Guyana's borders with Suriname, there has been a significant boost in health services with the addition of a state-of-the-art digital lab commissioned in April and a refurbished maternity unit in October 2019.
This lab would serve a wider cross range of services. More people can access more services. For example, we have clients that we send here. When we send them and they have a referral to go to New Amsterdam, like you said, some of them would leave their children at us because we have a daycare which is free. Sometimes we have to give them that money to go to New Amsterdam. When they go there and they do the test, sometimes when they go back the sample is bad or the test is not ready, that's an extra money. then you have to wait 2 to 3 weeks to get all those results. Now this is over. Today is a good day.
Other facilities commissioned to improve services in Region 6 include the refurbished pediatric ward, a new radiology department both at the Port Moran District Hospital, and the recommissioning of the National Ophthalmology Hospital. This has resulted in an increased number of persons accessing services at the facility within a one-year period.
Outpatient 9,354. That's for 2018, 2019, 14,002 patients. Admission in 2018, 40 patients, 2019, 96 patients. Consultation for ophthalmology, 2,055 in 2018, 2019, 2,911. Minor surgery, 60 in 2018, and in 2019, 315.
The regional hospital at New Amsterdam also saw a few of its facilities commissioned in 2019, including a new and spacious dental unit, a doctor's quarters, a medical laboratory, and a remodeled kitchen. CEO at the time, Dr. Samantha Kennedy, expressed appreciation on behalf of the staff for the improvements.
So I am happy to report that persons have been coming to the office, all staff members, and they're giving thanks and appreciation every day for the improvements that are made at here at New Amsterdam Hospital. The doctors speak of the doctors' quarters, and I saw the little room where they were and where they are now, and they said they're so comfortable, they're happy, and I feel very pleased.
Most of these facilities and units were commissioned following visits by the Minister of Public Health, where unfavorable work conditions were observed and efforts immediately made to bring about improvement.
A major concern to the Public Health Ministry and the Health Department of Region 6 was accommodation for nursing students studying to become registered nurses. To this end, a modern multi-million-dollar nurses' quarters was commissioned.
Student nurses who come from as far as Region 9 or communities in Berbice and Quarantine Rivers, and even way up the Quarantine Coast, can now be housed in a living space constructed specifically for them. These quarters are located in the compound of the New Amsterdam School of Nursing.
And to have a hostel constructed right in East Berbice Quarantine can only add value to the healthcare delivery of this region. We were told that not only Region 6 will benefit, but also all the other regions. And this is a testimony of the commitment of the government of Guyana to give reliable health services, accessible, reliable health services to all Guyanese.
Students attending the nursing school testify that residing at the new quarters has positively impacted their academic life. Fabian Rodriguez of Marurunau in Region 9 and Diane Edwards of Criverton both agreed that the facility allows them to spend more time focusing on their studies.
I have been blessed with the opportunity to study at the New Amsterdam School of Nursing and have benefited greatly from the newly constructed hostel. These benefits include adequate water supply, electricity, my room is comfortable and self-contained, and furnished to meet my needs. I love the fact that the hostel is located within the school compound. It has reduced my expenses since I do not have to pay to travel every day to school. At the hostel, I'm able to study in groups with my fellow colleagues.
Being a resident student at the New Amsterdam School of Nursing, to express my profound appreciation to our government and regional authorities. Firstly, for the training opportunity towards becoming a trained registered nurse. Secondly, and perhaps most importantly, for providing me with accommodation at this sparkling new nurses' dormitory. Coming all the way from Criverton, I am able to save the cost of traveling and to study in comfort, providing with 24-hour security service.
Senior nursing tutor at the school, Sister Oslin Hicken Paul, said that based on her assessment, there have been positive changes since nurses are now housed closer to school.
Now, having our students within the school compound is very beneficial in that the students are punctual for classroom session. There is a reduction in absenteeism. There is also a reduction in the financial burden on our students. There is extended interaction time for the students and the lecturers. Because they do not have to travel far distances, we can go a little beyond our call and be there for them.
The nurses' quarters stands at a cost of $49 million. It has all the necessary amenities, including indoor water supply, electricity, each room fully furnished and self-contained. More specifically, at the New Amsterdam School of Nursing, there are plans to establish a modernized learning environment.
This is just the beginning. We have a new wing on this very old building, and I heard Sister Hickens speaking of all the other needs in order to make the building one that can accommodate the services that they need to provide here to ensure that you can have a rounded education as you pass through this New Amsterdam School of Nursing.
Minister Lawrence believes that the availability of such facilities augurs well for the local health profession and encourages others to have great expectations.
Meanwhile, other infrastructural works have begun in 2019 and are expected to be completed this year. One such project in Region 6 is the new and improved state-of-the-art mortuary being constructed by the Ministry of Public Health to the tune of $70 million.
The mortuary being constructed in the compound of the National Psychiatric Hospital is the first of its kind being constructed in the country by the government of Guyana.
This facility is one with a difference, as the designs cater for a chapel for funeral services, a viewing area for post-mortems, and an administrative section. Ministry of Public Health's engineer Narish Mangar briefly explained what else the approximately 3,000 square feet building will accommodate.
In addition to that, it would encompass an administrative section where the doctors, after the post-mortem, right, they were able to review the results of the post-mortem and further complete the report. Right? It would be the first of its kind, I would say, a state-of-the-art facility. We intend to keep this as a template going forward.
The construction of this new mortuary comes after Minister Lawrence visited the New Amsterdam Regional Hospital in the latter part of 2018 and was dissatisfied with the location of the mortuary.
When I look at where that mortuary is placed and where my staff have to work, it is not conducive to proper working conditions. And so even as the health ministry, we try to provide a service to all the people in this country. The onus is on me also to ensure that I take care of our staff.
Permanent Secretary for the Ministry of Public Health, Colette Adams, and representative of the contracting firm executing the project, Ken Vincente, both signed the contract to initiate the commencement of construction. The project has been awarded to Andre Vincente Construction Services, who has assured that the building will be completed within contracted time.
Region 6 is regarded as the model region for health service delivery as the government continues to provide better facilities and services. This has been InfoHub Extended, where we looked at the massive developments taking place in the health sector in Region 6. Thanks for watching. Goodbye for now.